Hi guys, I want to talk a little bit about travel plastic surgery, and I'm not going to necessarily talk about people traveling to, the Dominican or Miami or whatever to get bad plastic surgery sort of stuff. I actually want to talk about when it's important to travel for plastic surgery because I think a lot of patients get confused out there as to what's available in their area and when they need to go see someone who's an ultra specialist. So the reason people come to see me and travel long distances is because I'm an expert at major body contouring and doing major combination procedures. So just to sort of clarify, there's a lot of plastic surgeons out there, even board certified plastic surgeons, and most of them are not really experts at body contouring. So what do I mean by that? Your average plastic surgeon who's board certified probably does breast augmentations, occasionally does breast lift with implants, occasionally does breast reductions. They might do a tummy tuck here and there. They probably don't do much liposuction with their tummy tuck. They don't really do body lifts. They don't really do arm lifts. They don't do thigh lifts. They don't do a lot of mommy makeovers, or they may occasionally maybe do one every 6 months or something like that. So on the other hand, body contouring specialists, of which I believe there are very few in this country, are really experts at major skin removal surgery and major liposuction. So how do you know someone's really good at liposuction or they do a lot of it? Well, they should be doing it almost daily. In my practice, I liposuction daily, multiple times a day. I remove maybe 15 to 20 liters of liposuction on average a week. And I remove over 10 feet of skin regularly. I routinely do 4 to 6 hour major combination procedures. So most of the plastic surgeons don't have that type of practice. I didn't start with that type of practice, and most of them don't. So when you have massive weight loss, or if you're wanting a mommy makeover, then you really need to consider seeing a body contouring specialist, okay? So if you have a tummy tuck and you don't really have any liposuction or lipocontouring, your results just not going to be that good. And if your doctor doesn't do a lot of liposuction to know where to liposuction correctly, in what areas and what layers, that sort of thing, then you're going to start to see significant differences in the results. And that's where the travel becomes more important. Not to mention, as you get into more significant skin operations, the complication rates shoot up. So long surgery time is a big red flag indicator for somebody who doesn't do a lot of surgery. So if you do a mommy makeover and it takes like 6 hours, probably your surgeon doesn't do many of them, right? Most of the time it should be 4.5 to 5 hours, depending on if you're doing a breast lift, implants, in addition to tummy tuck and liposuction, all that stuff. So having long surgery times can lead to high complication rates, high rates of infection, high rates of other complications that can occur, in addition to dissatisfaction with the final result, especially if you're looking at surgeons who do a lot of that and then you're comparing their work to them. So, and particularly for the weight loss patients. I had 2 patients that traveled last week. I had one that traveled today, and I think I removed 8 or 9 feet of skin on the patient who traveled last week. And it was sort of a revision of her prior work and then additional work and those sorts of things. So when you're getting into those major combination procedures where you're doing more than one procedure, it becomes critical for you to find the right surgeon, and traveling becomes more essential because I will tell you, there's just not that many surgeons in any given place that do major combination procedures, okay? So look at their websites, look at how many procedures they're doing, find out how long the surgery takes. A tummy tuck should not take more than 3 hours to do, and that's with liposuction. All right, if you're getting your breasts augmented in addition to your tummy tuck, or you're doing a breast lift with implants, it should never really be more than 5 hours. If it's longer than that, then your surgeon probably doesn't do many of them, and there's gonna be higher complication rates. You need to look and see that they have pictures of those. Look and see that they have reviews of that. I mean, look at their work. They should be doing this routinely, and then you know you're in good hands. Don't be confused. A very common mistake I see is the patient who their friend has a breast augmentation and really happy with their surgeon. They refer them for a tummy tuck or a mommy makeover, and the patient's unsatisfied with the result. Well, that surgeon is not a body contouring specialist. They just put breast implants in frequently, and it doesn't require the same sort of skill. I'm not saying that it would still be a helpful skill to have, especially if you're doing breast lifting or breast reduction, because those are contouring operations, and liposuction is needed for all those to get the best results. So keep those tips in mind and keep your eyes open, do your homework, and make sure you find the right surgeon. Thanks.